my name is Sydney Latham. I'm going to talk to you today about malaria. This is my audience. You can wave. Okay. Malaria is caused by a parasite that infects people through mosquito bites. There are 4 kinds of malaria: Plasmodium falciparum, Plasmodium vivax, P. ovale, and P. malariae. Malaria invades red blood cells, altering the host's blood and possibly causing organ failure if not treated rapidly enough. Malaria is most prevalent in Africa. The Anopheles mosquito is the only form of transmittance, but even so, more than 1 million people die of malaria a year. Prevention is key with malaria, as treatment for most is unavailable in time. Malaria comes from a single-celled Plasmodium protist. Plasmodium species have a structure consisting of a nucleus, mitochondrion, microtubules, and an apicoplast. The nucleus contains the Plasmodium parasite's genetic information. The mitochondrion produces energy for the single-celled organism, and the microtubules move proteins and other essentials within the organism. The apicoplast, a structure specific to protozoan parasites, has a currently undefined function but has been decidedly crucial to the protozoa parasite's survival, as without the apicoplast, the organism cannot attack new host cells. Plasmodium parasite surfaces are covered with numerous proteins. Some of the proteins on the surface of the organism help the parasites bind to host cells. Malaria virulence and toxicity varies from mild symptoms to death. The disease is characterized as uncomplicated or severe because of the variance in individual cases. As an infected mosquito bites a human, the malaria parasite is transmitted into the person's blood. The malaria within the blood is considered a sporozoite. As the sporozoites go into the liver, the parasites replicate and then proceed through the bloodstream again. Well, what is my presentation on?
Malaria transmission cycle.
Okay, cool. The parasites then invade the human host's erythrocytes or red blood cells as merozoites. The merozoites within the red blood cells replicate again before they burst out of the erythrocytes, causing the symptoms of malaria. The parasites also interfere with the host's normal pathophysiology by making the red blood cells adhere to the walls of major organs such as the heart, lungs, kidneys, and brain, a process called sequestration, resulting in less blood flow to vital organs. Sequestration causes the more severe symptoms of the parasitic infection. Severe cases can show symptoms such as cerebral malaria. Cerebral malaria causes abnormal behavior, seizures, coma, and altered states of consciousness. People with severe cases of malaria also present anemia because of the destruction of red blood cells during the life cycle of the parasite, low blood pressure, kidney failure, metabolic acidosis, and hypoglycemia. These symptoms are because of organ failures and alterations of the host blood. Uncomplicated infections present like the flu, going through stages of cold, hot, and sweat. The infected host will show signs of fever, chills, sweats, headaches, nausea, vomiting, body aches, and malaise. Pregnant women have a higher risk of the more severe symptoms, which can cause premature births or stillbirths. In general, populations at risk for malaria are where the Anopheles mosquito is found, as the Anopheles mosquito is the only form of transmittance for the malaria parasite to infect humans. Malaria infections occur predominantly in tropical and subtropical areas. Because of the wide range of the Anopheles mosquitoes, in 2015, 3.2 billion people, which is half of the world's population, were at risk of being infected with malaria. Malaria is preventable and treatable, but still affects those among the lower classes in developing countries because of lack of access to prevention and medical resources. The most vulnerable people groups are young children, pregnant women, and travelers, as these groups have decreased or non-existent immunity to the disease. Close to 90% of all malaria deaths in 2015 were in Africa, with an estimated 292,000 African children out of 306 global children dying before reaching 5 years of age from malaria. People traveling to Africa have a high risk of infection due to staying outdoors in camps where mosquitoes are abundant. So those who stay indoors, even in infested areas, may have no risk of being infected by the parasite because they are out of reach of the mosquitoes. Malaria is costly to individuals and the governments of the countries where it is most prevalent. For families, the treatment costs come from traveling to medical resources, loss of days of work, loss of days in school, money spent on prevention, and burial costs. Governments of countries infected with malaria are significantly set back from trying to supply and staff medical facilities, buying medications, spraying insecticide in public areas, and distributing insecticide-treated bed nets to civilians. Government time spent on malaria issues takes effort away from economic opportunities such as tourism. The best treatment for malaria is prevention. Protection against mosquito bites prevents the parasite from possibly infecting people. Preventing mosquito bites can be done by the use of insect repellent, clothes covering more of the body, and the use of mosquito nets. Malaria prevention tablets called anti-malarial tablets are available and advised before going to an infected area. Anti-malarial tablets reduce the risk of infection by 90%. The tablets may be taken before, during, and up to 4 weeks after returning from an infected area to go through the incubation period of the parasitic disease. For those infected with malaria, treatment is determined by which Plasmodium species caused the infection, the clinical status of the patient, and the drug susceptibility of the infecting parasites. For those who present symptoms of uncomplicated malaria, doses of hydrochloroquine are taken orally. The pediatric dose is adjusted to the patient's weight. For severe malaria, treatment is more aggressive. Treatment for severe malaria involves parenteral anti-malarial therapy for all species of malaria. These patients take quinidine gluconate intravenously for 24 hours. Once the patient can take medication orally, they can complete the treatment with oral quinine. Quinidine gluconate is cardiotoxic, so treatment must be made within an intensive care setting with cardiac and blood monitoring. So the treatment for the severe case is cardiotoxic. Yeah. So most deaths of severe malaria occur within the first day or two, so rapid treatment is necessary. Although malaria is still devastating Africa, there is hope to eradicate the disease completely, as malaria has been eradicated from many developed countries. Malaria is continuously studied and under surveillance, and investigations are underway looking for different treatments and preventions. Are there any questions? Yes.
What is Malaysia?
Malaise is a symptom of severe malaria, and it just means like general discomfort and uneasiness. Thank you. Okay, turn it off.
On the next.